You know, deep inside your body, right this second, there's this silent battle raging. It's a nonstop cycle of construction and demolition, and it's so intense that it rebuilds your entire skeleton about every 10 years. Today, we're going to decode the secret messages coming from this hidden world. So let's just dive right in and start cracking the code. And to do that, we're actually going to start with a puzzle. Now, this is a real question pulled from a 2006 medical exam for rheumatology specialists. So think of yourself as a clinical detective for a minute. Your mission? Spot the imposter in a list of biochemical signals coming straight from our bones. All right, here it is. We've got 5 suspects. A, urinary NTX. B, serum osteocalcin. C, serum CTX. D, urinary hydroxyproline. And E, serum tartrate-resistant acid phosphatase. Now, 4 of these are clear signals that our bones are being broken down, but one of them is an imposter. So which one is it? Go ahead and lock in your answer, and we'll see if you're right as we gather the evidence. Okay, so to solve this puzzle, you've got to understand the big picture, this fundamental process that's really at the heart of our entire skeletal system. It's this constant, dynamic tug of war between 2 opposing teams, the builders and, you guessed it, the wrecking crews. This whole process is called bone remodeling, and it's happening in every single one of us, all the time. It's how our bodies fix tiny bits of damage, how our bones adapt to stress, how we manage calcium levels. And it is so thorough, you literally get a brand new skeleton about every decade. I mean, how incredible is that? So let's meet the players, shall we? On one side, you've got the osteoblasts. These are our brilliant construction crew. They are meticulously laying down new bone. And on the other side, you've got the osteoclasts. This is the demolition crew, and they're super efficient at clearing out all the old, worn-out bone. Really, the entire health of our skeleton just depends on the perfect balance between these two. And here is the absolute key to our puzzle. Both of these crews, they leave behind evidence of their work. They release these very specific biochemical markers right into our bloodstream and our urine. And by measuring these markers, we can get what's basically a liquid biopsy of the skeleton. It tells us who's winning, construction or demolition. So here's how all that evidence stacks up. Over on the left, we've got the building signals, or formation markers. These are proteins, like osteocalcin, that get released by our construction crew while they're on the job. Then on the right, you see the demolition signals, the reabsorption markers. This is basically just the debris, the rubble left over from the wrecking crew's work, things like fragments of collagen called CTX and NTX. All right, we've met the crews. We've seen the evidence they leave behind. I think with this new info, we are ready to go back and finally solve our original puzzle. Let's see if that first guess you made was on the money. And the imposter is B, serum osteocalcin. If you pick that one, hey, congratulations, you nailed it. See, unlike all the others on that list, osteocalcin is not a signal of bone breakdown. It's actually the exact opposite. This is the key right here. Osteocalcin is a protein signature that is made exclusively by the builders, the osteoblasts. So when we see its levels going up in the blood, that tells us that bone formation is happening. It's a loud and clear signal of construction, not demolition. And this also shows us exactly why those other options were the demolition signals. NTX, CTX, and hydroxyproline, they're all just different pieces of the collagen scaffolding that gets torn down by the wrecking crew. And TRAP, that's an enzyme that gets released directly by the osteoclasts themselves. So yeah, they're all unmistakable signs of demolition. But why does spotting this imposter even matter? I mean, this isn't just some tricky exam question. Understanding these signals has a huge impact on how we actually diagnose and treat bone diseases out in the real world, for real patients. So just imagine a patient with osteoporosis. We can use these markers to see if they're what we call a fast bone loser, basically someone whose demolition crew is working way too hard. A doctor can then start a treatment to slow that crew down. And here's the amazing part. Instead of waiting a year, maybe 2, for a bone density scan to show any change, we can recheck these markers in just a few weeks to see if the treatment is actually working. It's a game changer. And this number, this is just so powerful. A 30 to 50% drop in markers like CTX after only 3 months, that is a very strong sign that the therapy is working. It gives doctors and their patients this rapid feedback, this confidence that they're on the right path, potentially years before an X-ray could ever confirm it. But you know, the story of bone remodeling is so much more fascinating than just lab tests. This internal dance between building and demolition, it holds some of nature's most amazing secrets and really points the way toward the future of medicine. I mean, just take the black bear. It stays almost completely still for months during hibernation. Now, in a human, that would cause severe bone loss. But the bear, it has a biological superpower. It can almost completely shut down its wrecking crew while keeping the builders on the job. It's no wonder scientists are desperately trying to figure out this trick to help astronauts in space and, of course, patients right here on Earth. And what about our hero from the puzzle, osteocalcin? Well, it turns out it's not just a simple building signal. It's a multitasking hormone. Recent discoveries are showing it helps regulate insulin in the pancreas and might even play a role in brain function and memory. Our bones are communicating with the rest of our body in ways we're only just beginning to figure out. You know, our ability to decode all these signals today, it really stands on the shoulders of giants. From the discovery of vitamin D's role in bone health, to figuring out how to sequence the genes for proteins like osteocalcin, all the way to understanding the cell receptors that actually hear these signals, every one of these Nobel-winning breakthroughs was a crucial step on the path to understanding our own biology. So as we wrap this up, just remember that this whole dynamic process of remodeling is happening inside of you, right at this very moment. It's this complex, elegant, and absolutely vital story being written and rewritten every single day. So the real question is, what story is your skeleton telling?